Borderline Personality Disorder Awareness, written by the Center of Excellence, narrated by Jane Branch.
Center of Excellence, Borderline Personality Disorder Awareness. Module 1, Overview of Borderline Personality Disorder. The term Borderline Personality Disorder, or BPD for short, which will be used throughout this course, was originally coined as it was believed that those who suffer from this were on the borderline between neurosis and psychosis. Neurosis is defined as mild mental health, such as low-level depression, stress and anxiety. Psychosis is defined as being a severe mental health disorder, where the individual has severely impaired thoughts and emotions, leading them to lose touch with reality, for example, schizophrenia. Typically, it was seen that this was diagnosed when healthcare professionals could not decide on a firm diagnosis. Furthermore, it was observed that individuals with this diagnosis did not have improvement in their symptoms through typical psychotherapies like cognitive behavioral therapy or CBT, nor did they respond to medications. Further research showed this not to be the case, and BPD is in fact, in layman's terms, a rapid fluctuation of change in emotion. It is now recognized as a real diagnosis and should be treated as such. The first medically reported sighting of borderline personality disorder-like symptoms was 3,000 years ago. However, it was not until 1980 that BPD would be an official psychiatric diagnosis when it appeared in the DSM-3. Borderline personality disorder is also referred to as emotionally unstable personality disorder and emotional regulation disorder. In the diagnostic manual, the ICD-10, which was produced by the World Health Organization, this disorder is defined as emotionally unstable personality disorder. In the Diagnostic Statistical Manual, DSM, which was produced by the American Psychiatric Association, this disorder is defined as borderline personality disorder, hence the interchangeable names used. Many are campaigning to get this disorder changed to emotional regulation disorder to decrease stigma, and many believe this name accurately describes the illness. To be diagnosed with a personality disorder, typically, the individual will have difficulties with how they feel and think about themselves and others, which in turn leads to difficulties in life in general. A lot of individuals with BPD and healthcare professionals have expressed they do not like the fact that BPD is classified as a personality disorder. This is mainly due to the invalidation this brings, as it makes the individual feel like there's something wrong with their personality and it is them at fault, which further adds to the mental and at times physical pain BPD sufferers have. Furthermore, most BPD sufferers had a traumatic childhood and have developed BPD as a result. This is a further reason as to why many are referring to it as emotional regulation disorder, and campaigns are ongoing to get this officially changed. The symptoms of borderline personality disorder can be clustered into 4 groups as follows. Emotional instability, also referred to as affective dysregulation. Impulsive behaviors, difficulties with interpersonal relationships, and cognitive distortions, also referred to as perceptual distortions. These 4 groups and further symptoms of borderline personality disorder will be fully explored in Module 2, Symptoms of Borderline Personality Disorder. It is best to think of BPD as a spectrum disorder. This is due to no size fits all, as no person with BPD presents with exactly the same symptoms as someone else.
Sample complete. Ready to continue?